Answering the question, am I doing well? Enhancing performance management through key performance indicators. The public health system in Andhra Pradesh, a southern state in India, is plagued by multiple problems. Poor deployment and management of human resources, insufficient monitoring of expenditure, and inadequacies in public health service delivery systems. Many of these problems emanate from a relatively underdeveloped information structure that does not allow informed decision-making by policymakers. Improvement of governance structures through comprehensive information management systems has become a key focus area for public systems across the world. State governments in India are pursuing the idea of establishing transaction-based monitoring and evaluation systems to improve their performance and effectiveness. Establishment of such structures is especially crucial for social sectors like public health, where the access to healthcare and its effectiveness is imperative for improving the population's health status and reducing age-specific mortality and morbidity. Government of Andhra Pradesh recognized the fact that management information and communication systems, development of key performance indicators, and evaluation of public health systems through appropriate use of such indicators will help in informed decision-making. This in turn will help improve the overall performance of the department. The major health sector reform program led by the Government of Andhra Pradesh, funded by Department for International Development (DFID) with technical assistance from FHI, ensured a platform for certain sector reforms. As a part of APHSRP, the department decided to develop and implement a comprehensive health management information system (HMIS) to provide decision support, augment evidence-based policy making, and facilitate effective monitoring to improve accountability and effectiveness at each level in the public health system. The Department of Health, Medical and Family Welfare engaged NISG to support developing the HMIS. A HMIS review team was constituted with membership from NISG, FHI, and the Strategy and Performance Innovations Unit (SPIU). They developed a revised design for the management information systems with inputs from various stakeholders. A request for proposal was written to develop comprehensive transaction-based HMIS software. Once the revised design was ready, FHI developed a range of indicators for each of the 6 major public health systems modules, duly covering the 24 sub-modules within the HMIS. The KPIs were the crucial component of HMIS, envisaged to support in the decision-making of performances of the different aspects of the public health systems. The HMIS was expected to cover all levels of all the sub-departments of the Department of Health, Medical and Family Welfare. Hence, the KPIs were necessary to be applicable across the department for all the key functionaries as well as functions. The team organized extensive discussions with the key government functionaries, reviewed the objectives, scope and performance of each of the programs and schemes. This was done to ensure that there is proper buy-in from the various internal stakeholders within the department. It was important to develop KPIs for both institutions as well as functionaries, as the performance of the two is interdependent. Realizing this, and to move from an institution-based functional monitoring to individual activity monitoring, the department requested FHI to develop KPIs for all the cadres. FHI identified 150 key cadres within the system, for whom KPIs needed to be developed. Assessing the enormity of work and limited timelines, it was decided that the KPIs would be developed only for key functional cadres, medical officer MO, auxiliary nurse midwife ANM, civil surgeon specialist and specialists from teaching hospitals. These were the 4 cadres selected, and they together made up to about 55,000 of the department's over 100,000 staff. The finalized KPIs were approved by the department for piloting in 3 districts of Visakhapatnam, Kurnool and Warangal, in the district hospitals of Andhra Pradesh Vaidya Vidhana Parishad, all teaching hospitals under Directorate of Medical Education, and all primary health centers in 3 pilot districts under Directorate of Health. Subsequently, KPIs were developed for 40 additional cadres whose performance was identified as critical for the department. KPIs were also developed for sub-departments based on the common and specific functions they perform. Today, the KPIs are being monitored very closely by the secretaries at the state level through the heads of the departments. The KPIs are also supporting departmental heads to keep track of relevant progress made within each subunits of their departments. In the weekly coordination meetings, the heads of departments report to the secretaries on their agreed KPIs. This is enabling the functionaries to focus on the critical aspects of service delivery, while it is supporting the senior policy makers to take decisions based on the performance on the key indicators. However, the Department of Health, Medical and Family Welfare should dedicate and engage itself to implement and monitor KPIs till they get integrated within the overall HMIS and eventually assist in monitoring the performance of the department.